Well, I'd like to welcome you to the second part of our presentation on COVID, seasonal flu, and what we can do to fortify our immune system. And as I always say, this presentation is for educational and informational purposes, and anything that you hear you would want to discuss with your doctor before you implement it in your particular case. So we've been talking about COVID and of course the basic strategy of our public health authorities and all has been to slow the spread, flatten the curves, and prevent the hospital system from being overwhelmed. And although different parts of the country are still facing their challenges, here in Florida and many other states, we're actually doing quite well. The basic strategy has been successful. And the question is how we can build on this success. The key point is to balance our legitimate concerns concerning COVID with the need to reduce unwarranted anxiety and fear. And I hope that this presentation will help you to do exactly that. So first of all, we know there are great efforts and great resources now being utilized to develop better, more effective therapeutics, treatments for COVID, and also the development and dissemination of vaccines is certainly current. But what's hardly discussed, as I've mentioned in part one of this presentation, what's hardly discussed are the ways to improve our God-given immune system, how to reduce the risk of serious infections. And this turns out to be the single most important thing that we can do, is to actually bring about greater vitality and greater strength to the immune system that we have to kind of protect us against infections. So how do we fortify our immune system? Well, I've said there's three basic things that we want to address, three basic things. One is specific nutritional supplements, particularly vitamin D and zinc. And particularly with the vitamin D, we would want to get to higher levels than are typically recommended. This is something that you can discuss with your doctor. You can get a vitamin D test. We discussed all of this in a lot of detail in part one of this presentation. There's also the issue of stress management, how we can relieve stress, because stress is a great depressor of the immune system function. So the more we can be in a state of peace and well-being, in spite of the challenges that we're facing, the stronger our immune system is there to be able to help protect us. The third element is what we would call metabolic health, and this is what I want to focus on today, metabolic health. So first of all, what is metabolic health? What is metabolism? We hear that word all the time, and the definition is that it refers to all of the physical and chemical processes in the body that occur when food is broken down, energy is created, and waste products are produced. So disordered metabolism is a key component of why it is that we're seeing so many people suffering with COVID if they actually do get infected. Disordered metabolism is something that we call, in the medical field, metabolic syndrome. And it's the most significant cause of virtually all of the comorbid conditions that, along with the virus, are actually responsible for most of the deaths and hospitalizations. Metabolic syndrome is a very strong risk factor for COVID severity and death. This was published just recently in August of 2020 in the journal Diabetes Care, that the cluster of high blood pressure, diabetes, and obesity, which are essentially the things that define metabolic syndrome, are linked to a fourfold greater mortality risk from COVID-19. So metabolic syndrome and the comorbid conditions that are associated with it, this is a key in being able to effectively improve our immune system function. And here we have some research from the Centers for Disease Control and Prevention in April and in August. They indicated that 50% of the COVID hospitalized patients have some type of comorbid condition, and 94% of the COVID mortality is due to some type of comorbid condition along with the virus. You can see things like high blood pressure, being overweight, chronic lung disease, diabetes, cardiovascular health. All of these things are components of this metabolic syndrome. Unfortunately, from earlier research, which has been corroborated by many additional studies, we find that really a very small number of our population here in the United States, and it's becoming increasingly a problem in the world, that really only a very small number of our population are what we would consider metabolically healthy. This came from the University of North Carolina, data from the CDC's National Health and Nutrition Examination Survey. And they said that 88% of American adults are not metabolically healthy, and 50% or so are either diabetic or pre-diabetic. So this is the issue that we want to really focus on. In addition to the supplements, in addition to stress relief, we want to look at how we can become metabolically healthy. And we see that society is becoming more and more aware of this, with children getting diabetes type 2. When I went to medical school, type 2 diabetes was considered adult onset. Now we see it in many, many children, 10, 11 years old. The issue of kids being overweight, and not just kids. Here, obesity in toddlers, 1/3 of 9-month-olds are overweight or obese. And this can't obviously be explained on the basis of lack of exercise or willpower. So there's some issue that's really driving this kind of metabolic disorder. And at the advancing age level, we see that things like Alzheimer's, dementia, which in many doctors are actually more and more considering it a type 3 diabetes. Dementias and Alzheimer's, a type 3 diabetes, because it's connected again to blood sugar control, metabolic function, and we're seeing, unfortunately, 5 to 10% of the people with this condition have early onset dementia, which often appears even when people are in their 40s or 50s. So the more we can address metabolic health, the more we not only help protect against COVID, reduce the risk of serious COVID or hospitalization, but we also are improving the health of our body and our whole system on so many levels simultaneously. So what's driving this epidemic of disordered metabolism and the metabolic syndrome? It basically comes to lifestyle issues. Modern diets and stress. Insulin is a factor with regard to controlling blood sugar. Stress hormones like cortisol also have an effect on the blood sugar, and the interplay of these destructive elements from the modern diet and from stress are what are largely driving this I would say, beyond an epidemic, it's a pandemic of metabolic dysfunction. Why? Look at Americans eating 152 pounds of sugar and 146 pounds of flour every year. These are the latest statistics. That's a pound of sugar and flour per person per day, which essentially is like the level of a drug dose. And these hyper-processed, hyper-addictive, factory-made industrial diets make us fat and sick by creating this metabolic syndrome and disordered metabolism. Here we have Dr. Lustig, from the specialist in pediatric hormone disorders, a leading expert in childhood obesity at the UC San Francisco School of Medicine, talking about sugar as a toxin, as a poison. I mean, it's very strong language, but this is how he talks about it. High fructose corn syrup, sugar, no difference. The point is that they're each bad, equally poisonous. So the more we can really understand the impact of sugar and refined processed wheat flour, the more we can begin to cut back on these things, and the more benefits we'll see to blood sugar and our whole metabolic function. Here's a graph looking at the average adult in the USA is consuming 1,000% more sugar than 100 years ago. Back then it was 18 pounds of sugar. Now it's 152. And this is coming again from the governmental agencies responsible for tracking these kinds of things. From the Journal of the American Medical Association, 6 years ago, a study of more than 40,000 people shows that those with the highest sugar intake had a 4-fold increase in their risk of heart attacks compared to those with the lowest levels. So this is really, the right supplements like vitamin D, this is something relatively easy to deal with. But when it comes to our metabolic function, it's more challenging because it has to do with the choices we're making every day. And I want to really kind of emphasize how much the value of being able to reduce the amount of sugar and flour that we're consuming. Of the more than 600,000 food products, and this was from Dr. Mark Hyman, who's the chairman of the Center for Integrative and Functional Medicine at the Cleveland Clinic. He said, note that I said food products, not foods, because these are processed food products. 80% have added sugar, and that's where the trouble begins. So we see now more and more medical scientists doing the research and disseminating the information out to the public. Here's one called Wheat Belly, written by cardiologist William Davis, who's explaining that even when we get a loaf of what's called whole wheat bread, eating two slices of that can increase blood sugar more than 2 tablespoons of pure sugar. And here Dr. David Perlmutter, well-renowned, highly renowned neurologist, who was talking about grain brain, the surprising truth about wheat, carbohydrates, and sugars, your brain's silent killers. So it's whether it's wheat belly or grain brain, the doctors are making the same point. These unhealthy carbohydrates, these sugars, these refined wheat flours, these are what are creating metabolic syndrome, weakening the immune system, and predisposing to all kinds of metabolic chronic illness, including, as I said, cardiovascular disease, even the dementias. You see, the modern dwarf wheat, it's a far cry from the amber waves of grain. I mean, those days are past. In the last 50 years, the grain has been so modified through different kinds of breeding processes. And so the modern wheat that we have today is short, stubby, hardly high yield plants. So there's a greater yield, which is good when we're feeding, for example, starving people overseas or even here domestically. But unfortunately, there's very little research on the health outcomes of higher starch and modified gluten products in wheat over a longer period of time. The research is only beginning to come in now that we see the impact of decades of this kind of processed food and what it's done to our metabolic function. And unfortunately, even though the marketing is kind of catching up with the science, so now you see everywhere whole grain this and whole grain that, unfortunately these ads can be highly misleading since they often contain very little of a whole wheat grain, and basically it's mixed with white flour. So what then is the best kind of diet? We now know that sugar and wheat products, particularly refined, are really a problem for us. So what should we be eating then? Well, it really comes down to eating real food, really eating food in its natural state as much as possible. Clean food, whole, organic, unprocessed food. As much as possible, we should be cutting down if it comes in a box, a package, or a can. We need lots of salads and vegetables with colorful nutrients and 1 to 2 pieces of fruit per day. Foods with lots of fiber. Grains like brown rice, quinoa, millet, vegetables like celery and asparagus, foods with omega-3 fats, the fish, that cold water fish like salmon, sardines, halibut, omega-3 eggs, nuts like almonds, macadamias, and walnuts. These are the foods that really will support a healthy metabolism, a balanced blood sugar situation. We can eat in limited quantities the unprocessed, non-wheat and gluten-free grains like quinoa, millet, amaranth, buckwheat, brown rice. These are better as grains. But generally, we want to eat less grain and eat more fruits and vegetables. Those are the good carbohydrates. If you're really not having a problem with weight or blood pressure or some kind of chronic disease, if you're already healthy and fit and are not gluten sensitive, you could consider kind of as a treat sprouted whole grain breads. But again, I would say begin to develop a taste for sandwiches made from lettuce, where you have lettuce as the covering. This is really a very, very good way of cutting down on the amount of bread. So what are the action steps? Well, again, eating real food, organic, free-range, cage-free, healthy fats and carbs, reducing the sugar, the wheat flour, and the processed vegetable oils, the trans fats. Again, other aspects of a healthy lifestyle, regular exercise, sufficient sleep, and sunlight, filtered water. These are other elements of really having a healthy lifestyle. This is just so key to our desire to reduce the risk of COVID, seasonal flu, and so many other health conditions. You should ideally have your vitamin D level checked. You can add vitamin C and zinc. The omega-3 fats are very anti-inflammatory. And of course, stress relief, which we'll be doing in part 3 at another time. But these are the elements of what it can take, specific action steps that you can begin to take in your home with your family, that you can begin discussing with your friends. It's a community effort to really move in a healthier direction, really support this body that God's given us to really be able to live a life of great contribution and very high dimension. So thank you for your interest and for watching this presentation, and I wish you the very best of good health to you and your family. God bless you.